One of the issues that seems to continue to come up just in general in just about every election that you're paying attention to right now, and with your campaign specifically, is healthcare.
Yes.
You see an opportunity for New York State to be a bit of a laboratory, a leader in healthcare.
Yes. So New York has a bill called the New York Health Act. It's been in front of the legislature for a number of years now. The Assembly has passed it 4 terms in a row. The state Senate didn't even take up the bill until this last session when the Democrats gained control of that body. The Democrats right now are 1 vote short of passing that bill. And I hope to be that vote that would change that and would actually pass that bill. So the bill provides single-payer health care for all New Yorkers. It will guarantee quality health insurance for every single New Yorker. And it does it in a way that studies have shown will put money back in people's pockets. It'll be less expensive than the current situation, the current method of doing healthcare that we do. Having done that, if this passes, it will be the first state in the union that'll have single-payer healthcare. And it can be then used as a model for what we can do nationally.
Now, this isn't a public option, correct?
Correct.
This is full-on single-payer healthcare. Do you feel like we can sell most Americans on single-payer healthcare? I know that we can sell Bernie Sanders supporters on single-payer healthcare. A lot of folks remain skeptical. There's a lot of heavy lifting, I think, to be done to show people that this can work.
There absolutely is a lot of heavy lifting to be done because the talking points have been around aspects of it that are not necessarily the correct aspect to look at. So if the talking point is taxes, that's not what we want to talk about. We want to talk about money in your pocket. It's going to save you money. The RAND report, which is a conservative think tank, did a report on this, and they projected that the average person would save $3,000 a year on healthcare. That's money back in your pocket. Putting money back in your pocket means that you can then use that to support your local economy. So the same report indicated that if we passed this bill, we'd grow the New York economy by 2% just by passing this bill. It's not just about healthcare. It's also an economic solution. It also helps the economy. And then the other part of it that I'd like to talk about is if we no longer have to worry about healthcare, we can take risks. We can be entrepreneurial. We can say, I'm going to start this job that I want to do because I'm not worried about having to get healthcare from the current job I have.
Yeah.
So those kinds of things can be used to expand our economy. So that's the message that we give on this bill. It's not just about healthcare. It's about understanding that healthcare is a human right, making it be a human right. And once we do that, we take away a lot of worries that people have had, and we allow them to be more free in what they do with their life and how they take risks and move forward.
It's pretty easy to imagine that the talking point that will come from your opponent, should you get the nomination through the Democratic primary and face current state Senator George Amador, the rebuttal will be, who's going to pay for this?
Right.
Your taxes will go up. How do you respond to that?
The taxes will go up, but your total cost will go down. Many people pay thousands of dollars a premium a month. And then with that, we still get thousands and thousands of dollars of deductibles and copays. So my overall cost as, someone in the middle class will go down. For the average New Yorker, you're going to save $3,000. And the average business who pays insurance now will save between $200 and $800 per employee per year.
Because businesses, for one thing, will no longer be tied into providing health care for their employees.
Exactly.